afternoon, everyone. Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from Mayor, le maire, Jim Watson, followed by Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, président du Conseil de santé d'Ottawa, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence. Available for questions from the media following the statements, we also have. Disponible pour répondre aux questions des médias, nous accueillons aussi la docteure Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique. Dan Chénier, General Manager, Cultural and Facility Services, Directeur général des loisirs, de la culture et des installations. And Marie-Claude Turcotte, Manager of Immunization at Ottawa Public Health, gestionnaire d'immunisation, Santé publique Ottawa. After we hear from the panelists, we will take questions from the media. We will begin now with remarks by Mayor Jim Watson.
Well, thank you very much and good afternoon, everyone. Bon après-midi tout le monde, and thank you for joining us for this media availability. As we've seen over the last couple of weeks, the number of COVID-19 cases in Ottawa is rising rapidly. These numbers are concerning to say the least, and it's clear that something needs to be to change in order to address this. As Dr. Etches has recently mentioned, hospitalization and the numbers of people in intensive care are increasing, and our COVID-19 assessment centers are reaching capacity. Notre système médical est étendu au-delà de ses limites. Earlier today, the Premier announced that all of Ontario will enter the shutdown status beginning Saturday at 12:01 a.m. Based on the data that is before us, I fully support this decision. I know this was not made lightly and that it is going to be very difficult for many of our fellow citizens, including those who operate small businesses. I encourage residents to support them in any way they can, now more than ever. If you have the means, I'd urge you to order takeout from your local food restaurant this weekend, many of which have already placed their food orders for the long weekend. So this news will be particularly difficult for them. So if you do have the means to go out and support one of these businesses that has this large inventory on hand, please do so. S'il vous plaît, allez soutenir nos petites entreprises qui ont besoin de notre aide tout de suite. I know the roller coaster of lockdowns and openings can cause a serious strain on your mental health. If you need to speak to someone, I urge you to call the Ottawa Distress Center at 613-238-3311. That number again, 238-3311, 238-331. The move into the shutdown status will temporarily close city-managed recreation and cultural facilities for indoor activities, and a notice will go out shortly in the next hour with all of the changes and specific details. Shutdown status will not impact the operations for vaccination clinics, respite centers, COVID-19 assessment centers, municipal childcare centers, before and after school programs, and inclusive recreation programs. Those all continue. Of note, our vaccine clinics will be running throughout the long weekend. On vaccination clinics, I want to make mention today that we continue to make progress. To date, we have administered 145,000 COVID-19 vaccinations in Ottawa. Over 56,000 appointments have been booked through the provincial booking system, and just over 17,000 appointments have been made through OPH's booking line since the beginning of March. Last week alone, over 25,000 doses were administered. The number will only grow week over week as our vaccine supply increases. Fortunately, we are not experiencing the same vaccine hesitancy that appears to be impacting other parts of the province, in particular Toronto. I want to thank sincerely Dr. Etches and her great team at OPH, Anthony DiMonte and his emergency response team, and our community health partners in helping to educate Ottawa residents about the importance of getting vaccinated when they are eligible. I know there's been a lot of news about Ottawa not getting its per capita fair share allotment of vaccines. That's why I was pleased today, after Councillor Eglin and I had sent Minister Elliott a letter, that they were able to get back to us to indicate and confirm that the province has released a list of 34 pharmacies in Ottawa that will be provided with the AstraZeneca vaccine. We've also learned that a select number of primary care providers will also be given the vaccine to administer as well. For the most up-to-date details on booking a vaccine through a pharmacy, please visit covid-19.ontario.ca/vaccine-locations. I'm going to give that again because it's rather complicated, but it's the provincial site, covid-19ontario.ca/vaccine-locations. Based on the preliminary list of pharmacies provided by the province, there appears to be some geographic gaps in coverage in Ottawa. However, I'm hopeful that this can be resolved as more pharmacies are added. We have the challenge, of course, of a very large piece of geography that makes up the city of Ottawa. I'm hopeful that this vaccine delivery, it will provide some relief to the pressures on our community vaccine clinics. As we saw earlier this week, the clinics can be booked up literally within hours of slots becoming available. As we lower the eligibility age, the system will only book up faster. So getting as much vaccine here as possible will be crucial so we don't see a repeat of this in the coming days. As I mentioned, Ottawa residents have shown their desire to be vaccinated, and I don't want this enthusiasm to fade with older residents not able to book an appointment. Every vaccine administered is potentially one more chain of transmission broken, and it could mean one less person in the hospital. So let's get these vaccines out as quickly as possible, but let's make sure that we don't lower the age too quickly without increasing the number of vaccine shots as quickly as possible. Nous devons sortir des vaccins le plus rapidement possible. Finally, as we head into the Easter weekend and other important religious holidays on the horizon, I want to remind everyone that we need to continue to follow the provincial restrictions as well as the advice of our local medical experts. I understand that people like to get together with family and friends, especially to celebrate these occasions. But as a community, we need to buckle down and celebrate within our own households this year. I'll be celebrating Easter on my own, but I'll be taking time to reach out to friends and family by phone and Zoom. In closing, I'm not going to sit here and lecture you on the need to follow public health guidelines. You know those guidelines, and we appreciate those many, many people who have followed them diligently. We know what needs to be done to get our COVID levels down to manageable levels. And I know many of you, if not all of you, are tired, and some of you may have let your guard down over the last few weeks, either intentionally or unintentionally, and I myself include myself in that group. But let's use today's announcement as an opportunity to reset and refocus our actions, and let's not give these restrictions a reason to be extended any further. More importantly, let's give our vaccine campaign a fighting chance against this virus so we can have a close to normal summer if we win this battle in the spring. Je suis convaincu que nous pouvons le faire. And if I could just make one more important request, and that is please stay on this side of the Ottawa River unless you need to go to Quebec for work or care for a loved one. La ville de Gatineau éprouve maintenant un très haut taux de transmission de la COVID-19. I've spoken with Mayor Pedneau-Jobin just a few hours ago, and we both agreed that for the time being, we will be telling our residents not to visit each other's cities. Alors, pour le moment, je demande aux résidents d'Ottawa de rester à Ottawa jusqu'à ce que la situation se stabilise dans nos deux villes. I now ask Councillor Keith Eglin, the Chair of Ottawa Public Health, who continues to show great leadership on this file, to take the floor. I wish everyone a very happy and safe long weekend. Happy Easter. Merci.
Thank you, Mr. Mayor, and good afternoon, everyone. Bonjour, Quay. Thank you for joining us. With today's announcement, I'd like to recognize how difficult the COVID-19 pandemic has been for our entire community. It has been said before and it will likely be said again. It has been hard, and we have all made sacrifices and have been impacted to varying degrees to support the health of our neighbors and the proper functioning of our healthcare system. We have to band together once again to help protect our family members, our friends, our neighbors, and community members who live and work in our city. It is difficult to hear that another lockdown is required, but without it, more people will get sick. There will have to be longer and stronger lockdowns. We will see more businesses suffer and see our healthcare system become overwhelmed. That is why we have to take action now. If you have made plans with members outside of your household for the long weekend, please cancel them. In order to keep our schools safe and open, please do not visit with other households. A sleepover or even a backyard barbecue with another family is not worth putting yourself or others at risk. Our healthcare workers are tired. We are all tired. We aren't there yet, though. Vaccines are coming, but for the next few months, we have to keep up these measures while we continue to vaccinate those at the highest risks from COVID-19. Traditionally, the April long weekend is spent with family, but here we are again asking you to do things differently once again. Easter is often seen as a time of renewal, and that is what we are collectively asking you to do today. We are asking you to renew your vigilance and to be aware of risky COVID behavior. Renew practicing COVID-wise habits like hand washing, mask wearing, and physical distancing. And finally, to renew your collaborative and cooperative caregiving in our city. I know that we can do this. Please do not host or attend events this weekend with members outside of your household, unless as a caregiver or if you live alone. Instead, plan a virtual brunch or Easter dinner with the family. You can do your part to support local businesses by ordering in. With the variants of concern circulating, we need to be more careful than ever. If you are dropping off gifts or treats to friends and family to mark the long weekend, please do so safely. Wear a mask and maintain 2 meters of physical distancing, even outside. If you haven't yet downloaded the COVID Alert app for your phone, I'd once again urge you to do so. It's an important step you can take to protect yourself. The app will notify you if a phone was near you in the last 14 days from a user who tested positive and logged it in the app. The COVID Alert doesn't use GPS or track your location. It has no way of knowing your location, your name or address, your phone's contacts, or health information of anyone you're near. Please check your mobile phone's app store and consider downloading COVID Alert. This has been a tough week for everyone, but it is important to remember that this is not forever. We still need to do what we can to protect the most vulnerable within our communities and to support the already tired healthcare workers who've been working hard every day responding to the pandemic. I hope you have a restful long weekend. Please stay safe and stay healthy. Thank you.
Thank you very much, Chair Eglai. We will now be hearing remarks from Anthony DiMonte.
Good afternoon, bon après-midi. The Premier announced earlier this afternoon that we are entering into a province-wide shutdown, and it is difficult but not unexpected reality for our community. Enforcement staff are reviewing the parameters of the restrictions imposed by the province and are conferring with ministry officials and Ottawa Public Health team to understand the full scope of what moving into a shutdown means this time for Ottawa. As this review is ongoing, media and residents are encouraged to monitor the City of Ottawa and Bylaw Regulatory Services social media channels for more information as it becomes available. Alors que cet examen se poursuit, nous encourageons les médias et les résidents de surveiller les médias sociaux de la Ville d'Ottawa et des services de règlement municipaux pour obtenir les plus amples renseignements dès qu'ils seront disponibles. Our community has been here before. We know how to fight back against this virus by following our public health guidelines. Vaccines also play an essential role, and that's why we are working hard to get shots in arms as soon as possible. Earlier this week, the province announced the opening of a COVID-19 vaccination bookings for all Ottawa residents aged 70 and older. Plus tôt cette semaine, la province a annoncé le lancement de la prise de rendez-vous de vaccination contre la COVID-19 pour tous les résidents d'Ottawa âgés de 70 ans et plus. There was a tremendous demand for appointments, several thousand secured bookings, and as many of you are aware, all available appointments that are based on vaccine availability at all our community clinics have been filled to April 7th. The amounts of vaccine we receive from the province fluctuates from week to week, and as such, we are allocating doses over 2-week operational periods to bring some predictability to the appointment availability across the community clinics and other delivery models. The province has confirmed that Ottawa will additionally receive more than 11,000 doses of AstraZeneca next week, which will be distributed to physicians at select community health centers and family health teams. More information, including locations and other details, will be available shortly. We continue to work with the province to secure more vaccine supply and open new booking appointments in the provincial booking system, and we expect more appointments will be available soon. Nous continuons de travailler avec la province pour obtenir plus de vaccins et offrir de nouveaux rendez-vous dans le système de réservation provinciale. For those eligible residents waiting to book an appointment, I encourage you to follow the City of Ottawa and Ottawa Public Health social media channels and tune into our local media for updates in the coming days. We learned as well today that pharmacies in Ottawa will begin providing AstraZeneca vaccinations to Ottawa residents aged 55 and older. Additional information as well as participating locations can be found on ontario.ca. These vaccinations are separate from Ottawa's public health and the City of Ottawa's vaccine rollout. Please call the participating pharmacies directly to book or call the Province of Ontario Vaccination Information Line at 1-888-999-6488 if you have any questions on the pharmacy vaccination program. I want to thank residents for their patience and understanding. We know those eligible are anxious to receive their vaccinations as soon as possible. Je tiens à remercier les résidents de leur patience et leur compréhension. Nous savons que ceux qui sont admissibles sont impatients de recevoir leur vaccin dès que possible. I also want everyone to know that we're working hard and are committed to getting information out to residents as quickly as possible when there are any changes or updates. In the meantime, we are continuing to make progress in the administration of vaccines, and we are delivering thousands of doses every day. To date, we've administered a total of 145,787 doses in Ottawa as of last night. Earlier this week, we launched pop-up clinics for residents aged 70 and over that live in our 4 rural wards. In addition, we announced that adult recipients of chronic home care living anywhere in Ottawa can book an appointment at the Canterbury Pop-Up Clinic or any of the city's other pop-up clinics. Plus tôt cette semaine, nous avons lancé des cliniques itinérants pour les résidents de 70 ans et plus qui vivent dans nos 4 quartiers ruraux. De plus, nous avons annoncé que les résidents qui reçoivent des soins à domicile en raison d'une maladie chronique vivant n'importe où à Ottawa peuvent réserver un rendez-vous dans la clinique itinéraire de Canterbury ou dans n'importe quelle des cliniques autres villes cliniques itinéraires de la ville. Also new this week, patient-facing high-priority healthcare workers, such as chiropractors and psychologists, are now able to pre-register for vaccination appointments, as are faith leaders who are at increased risk of exposure to COVID-19. We also continue to partner with the Wabano Center for Aboriginal Health, the Akusavik Inuit Family Healthcare Team, to provide vaccines to Indigenous adults. We also continue to work closely with our partners at the Ottawa Hospital and Queensway Carleton Hospital to deliver vaccines to thousands of local healthcare workers. Our planning for phase 2 is well underway, and we are ready to go and waiting to ramp up capacity as soon as we receive additional vaccine supply. Notre planification pour la phase 2 est bien avancée. Nous sommes prêts à nous lancer et nous attendons l'augmentation de la capacité dès que nous recevrons l'approvisionnement des vaccins accrus. In closing, our vaccination clinics will continue to operate through the Easter weekend to get vaccines in arms, and will continue to operate 7 days a week as we have since we've stood up. We know this has been a long and often frustrating road, but we must remain resilient. With the arrival of vaccines and the progress we are making in their administration, we can look forward to brighter days ahead. Thank you very much. Merci beaucoup.
Thank you very much, Mr. DiMonte. I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. So we will now begin with Nicole Williams at CBC Ottawa.
Hi there. My question is for Dr. Etches. Dr. Etches, I'm wondering specifically what you make of this sort of sweeping lockdown by the province. I think a lot of people aren't seeing strong enough measures here. They're wondering just how effective it'll actually be in curbing cases. I'm wondering if you could speak to how effective you think this yet another lockdown like this is going to be.
Thank you. What I know in Ottawa is that we have more COVID in our community than we've ever had. When we look at the level in the wastewater, that is concerning the number of people testing positive, the number of people showing up at our testing centers. It's clear this is putting pressure then, although it's younger people who aren't as at risk of dying, there is still pressure on the health system. And this is just the beginning. As we look ahead, if measures weren't put in like this, it would cause more strain than we can handle. Unfortunately, we all need to do a bit more. So I think the restrictions announced today by the province are definitely needed here in Ottawa, and we're going to monitor and see how our population does, and we'll take a look at all of the details about what's required. If we're seeing areas of risk continue in our community, then we'll have to think about what local action could be taken.
I guess the question could be, though, then, I guess I just think that a lot of people are experiencing a kind of whiplash here. And every time we open, it seems that the case counts climb. Things don't really seem to end well. We always seem to be ending back in lockdown.
This is going to be different. This is different this time because we have the vaccination program that started. So what's already happened is we have people in long-term care and retirement homes that are well protected. And that protection is extending into the community now. We have reached our target of, over 83%, 4%, I think, of people over 90 are protected. Our target reached for people in their 80s, 75, 76%, I believe, are protected. So we just need to get to people in their 70s, 60s, and downwards, and we will see that makes a difference in terms of the pressure on our health system. Younger people are not likely to have the severe illness, and so we just need a bit more time to get down through the age groups to reach populations that are at higher risk. Then we should not need this kind of lockdown over again.
Thank you very much, Dr. Etches.
Excusez-moi d'interrompre. Est-ce que c'est possible d'avoir cette réponse-là en français aussi, s'il vous plaît?
Oui. Je sais, c'est difficile d'avoir un confinement comme ça encore, mais c'est différent 7 ans parce qu'on peut voir la protection de la vaccin qui est là maintenant pour les personnes plus âgées, mais c'est une protection qui vient pour les autres, mais c'est pas complète dans la communauté. C'est plus que 75% de la population dans leur 80e année qui a la protection de la vaccin, mais c'est moins pour les personnes dans leur 70e année, et aussi moins que ça, éventuellement, ça va arriver, la protection avec le vaccin. Alors, ça peut éviter un autre confinement, mais à ce moment, nous n'avons pas cette protection. Et pour l'avenir, oui, c'est une maladie moins sévère pour les personnes plus jeunes. Ça, c'est bon. On va arriver à ce point où on peut gérer la situation. Mais à ce moment, aujourd'hui, nous avons le taux de COVID-19 dans la communauté qui est c'est trop haut pour notre système, et il y a des gens en danger encore.
Merci beaucoup. We will now be going to Eric O'Brien at City News Ottawa.
Thank you. Good afternoon. Maybe I'll start by asking Mayor Watson a question. What are your thoughts about this new round of lockdowns in the city, given that you're going to be tabling on April 14th a business reduction business tax reduction for small businesses in the city?
Yeah, this is going to be a very difficult news for a lot of the business community because obviously they have gone through the roller coaster of decisions up and down for the last 12 months. So we continue on with our proposals that we'll bring to council and committee later this month because those have some implications that will help the business community in the short term, medium term, and long term. But no question about it. I was listening to my colleague John Tory. They just opened their patio season, for instance. Now they have to shut it down. And of course, we had lots of patios open earlier this year, and they will be shut down as well, effective basically Friday at midnight. So, we still are not going to give up on the small business community. We really do urge people to go out and help these businesses. I played my part. I just came back a little while ago from Vanier, and I got a pizza kit from Louis Pizza on MacArthur. And if people can go out and help with those orders, particularly this weekend, because as I mentioned, these businesses have gone out, they've got all of their bulk food in anticipation of Easter brunches and Easter dinners. And now they don't want that food obviously to go to waste, but also it's a great cost to them. So if people can, please go and help these businesses any way you can, please do so. Thank you.
Thank you, Mr. Mayor. Dr. Etches, can I get a reaction about the provincial decision to keep schools open during during the lockdown?
Yes, I respect the provincial decision to keep schools open, knowing how essential that service is for children, youth, and their families. We have been through a lot as a community, as parents of school-aged children, using up all our vacation to be home with people who need our support for online schooling. People are out of options. It's very challenging when people need to get to work to pay the rent. So there are a lot of variables where we know still some communities are harder hit than others and have less ability to manage without schools open. So the schools are under strain with the level of COVID in our community. It's too high for them to be, operating as comfortably as they can with their staffing levels. And so we need to bring the levels down so that our schools can handle the situation more easily. We continue to see large numbers of school-age children present for testing to make sure they rule out COVID. And we're keeping a close eye on what happens when people are testing positive and have been in schools. We were certainly following what was happening with variants of concern very carefully in schools, and that was reassuring. We did a lot of testing related to those situations, and we did not find evidence of greater rates of spread within the close contacts. So, we need to continue the protective measures in schools, and supporting our schools is one of the ways we're going to continue to proceed.
Thank you.
Thank you very much, Eric and Dr. Etches and Mayor. We will now be going to Josh Pringle at CTV Ottawa.
Thank you very much. My question is for Dr. Etches, just picking up on Nicole Williams' question. Are you optimistic that this could be the final 4-week shutdown that we would need before the vaccines really start ramping up in this community, or is it still too early to say that for sure?
This is my hope that we would have enough control brought to turn the curve again, to bring COVID levels lower, that we would not need to do this again as we then protect our population with vaccination. So we're moving quickly through the age groups. People now in their 70s are the population of focus. Soon it will be people in their 60s. And actually, we do have more options. Even today, we heard coming for people 55 and above. Once we get these populations protected, that does make a difference in terms of who is at risk for showing up in emergencies and hospitals. The higher the level in the community, the more we will see spread in younger populations at a level that some people are going to have severe disease. So, but we'll look forward to that. We have the experience in other countries. The UK and Israel are encouraging places where they had variants of concern. They had to do lockdowns until the COVID levels were brought lower, and now they're being able to ease out of the lockdowns because the vaccination is in place. So that's what we're going to get there.
Thank you. My follow-up question for Mr. DeMonte. You said 11,000 AstraZeneca doses are coming to Ottawa. Are those for pharmacies, or will you be able to use those in the mass vaccination clinics?
Yeah, no, as I indicated, it's a bonus, I guess, to see AstraZeneca arriving in our community. Those 11,000 are targeted, as I mentioned, for the physicians in those community health groups. And then supplementary to that, other AstraZeneca is arriving for the pharmacies. So it's above and beyond what we're doing in all our clinics and all the other, challenges that we're targeting. So that's very positive news.
Thank you very much. Sorry, we will now be going to Craig Lord at Global Ottawa.
Thanks very much. I think this might be a question for Dr. Etches. We have heard about a little bit of vaccine hesitancy in places like Toronto and even across the river in Quebec, but Mayor Watson seemed to signal, we haven't maybe seen that in Ottawa. Do you have any sense of whether that's accurate, whether we are really avoiding vaccine hesitancy, and why that might be?
What we're seeing is that the majority of the populations eligible for vaccine are presenting to be vaccinated. So we've surpassed the 75% of the population that's eligible target as we proceeded through long-term care home residents, retirement home residents, people over 90, people over 80, people over 70 is underway. So we'll see, but it's tracking that way. So I think we're not likely to hit 100%. People do have questions still, and we need to answer those questions. We are seeing as people get more experience and they can see what's happening as people get vaccinated, that comfort can grow. We want to continue to use all the messengers we can to explain to people the vaccines in Canada are safe and approved for use as they're effective to prevent COVID-19 infection and severe outcomes. So, we're working with community agencies, we're working with faith leaders, we're working with, leaders in the Black community. So we will continue to make sure people have their questions answered.
Thanks. And also following up on something the mayor said, that he kind of reached an agreement with the mayor in Gatineau to encourage limited travel between the two provinces here. Has Ottawa Public Health seen much transmission cases originating from Gatineau or Quebec?
This is one population, so there is every day there is connection between Ottawa and Gatineau when it comes to someone who tested positive and their contacts or their workplace. It's intertwined, absolutely. So the message is to keep the travel across the bridges to essential travel. Don't add to the mixing of populations. It's the same thing as the message is anybody, whether across the river or in Ottawa, that doesn't live with you, needs to be treated as somebody that you should visit with distance and outdoors. Really being careful to stick to more essential connections and avoid that close contact with people outside your home.
Thank you very much.
Thank you very much, Craig. Ça va maintenant passer à Julien Paquette à le droit.
Bonjour. Ma première question, j'aimerais entendre autant M. le maire que le Dr. Etches. M. le maire, vous avez mentionné que vous-même aviez peut-être un peu relâché votre vigilance dans les derniers jours. Dans le fond, j'aimerais vous entendre sur ce que ça vous dit pour la population en général, que même vous, Monsieur le maire, qui devez répéter les consignes de base régulièrement à la population, que vous ayez un peu peut-être expérimenté une fatigue par rapport au respect de ces consignes-là.
Oui, certainement. Je pense que tout le pays, toute la ville est fatiguée de cette situation très sérieuse. Et c'est difficile de répéter les mêmes phrases et les mêmes avis à la population, parce que la population avait un niveau de frustration. Certainement pour les petites entreprises, c'est une situation très difficile. Les personnes ont perdu leurs emplois, le propriétaire a perdu peut-être tous ses fonds pour son retraite, etc. Alors, maintenant, on avait une situation plus sérieuse que le passé avec les variants, et ça, c'est une situation très sérieuse. Et ça, c'est la raison que je dis que j'appuie le premier ministre et sa décision aujourd'hui. Et donner un autre, comment est-ce qu'on dit, un pli pour la population de respecter les règlements. C'est pour 4 autres semaines, et j'espère après ça, si on suivra les règlements de la santé publique, on avait un été plus agréable pour toute la population. Mais les prochaines 4 semaines, c'est 4 semaines très, très difficiles pour les étudiants, pour les jeunes membres de votre famille, pour les petites entreprises. Merci.
Est-ce que je peux vous entendre aussi, le Dr. Etches, là-dessus, sur le niveau de fatigue de la population?
Je pense que c'est vrai, c'est une réalité que tout le monde est fatigué. C'est difficile. Je pense que c'est important de aussi trouver espoir dans le programme de vaccination. On peut voir un différent avenir bientôt, mais la fatigue est réelle, et c'est pourquoi c'est aussi important de faire les liaisons avec les autres virtuellement ou dehors avec distance. Ce n'est pas un temps où on a besoin d'être isolé socialement. Physiquement, oui, on veut avoir la distanciation physique, mais continuer d'offrir soutien aux autres, faire les appels, faire les textos, faire les visites avec moins de risques.
Et ma question suivie, ce serait pour vous aussi, Dr. Etches. Hier, pas plus tard qu'hier, dans le fond, vous nous disiez que vous aviez recommandé qu'Ottawa passe en zone grise, et on annonce aujourd'hui qu'essentiellement, le gouvernement de l'Ontario va un peu plus loin que ce qu'on avait comme zone grise encore hier. Est-ce que vous êtes surprise que le gouvernement aille plus loin, ou ça faisait un peu partie de ce que vous souhaitiez voir finalement?
Je voudrais juste confirmer quand vous êtes plus loin, est-ce que c'est comme que la province est plus stricte que...
Oui, la province est un peu plus stricte que bon, le cadre qu'on avait devant nous hier pour qu'est-ce qu'est une zone grise. Bien, finalement, on ajoute certaines mesures supplémentaires aujourd'hui.
Oui. Pour moi, c'est clair qu'on a besoin de plus de mesures pour éviter les contacts étroits entre les gens qui n'habitent pas ensemble. Alors, les mesures de la province annoncées aujourd'hui, c'est dans cette direction. C'est pour éviter les contacts étroits qui donnent l'opportunité pour la transmission de COVID-19. Alors, je comprends leurs mesures.
Merci.
Merci beaucoup. We will now be going to John Willing at the Ottawa Citizen.
Thanks, Kina. Mayor Watson, the shutdown is going to obviously hurt the city's finances. Would you expect the province to pump more operational funds into municipal budgets beyond what was announced in the provincial budget?
Yeah, that's to be determined, John. Obviously, we will see a reduction in rental fees and so on, and it will have, I'm sure, a negative impact on transit fees. So the Treasurer is bringing forward a financial update to FEDCO later this month. But in all discussions I've had over the last couple of weeks and months for that matter, with our federal and provincial partners, they have consistently been there to help and backstop some of the extraordinary expenses and revenue losses cities have faced in Ontario and Canada. And I anticipate they will continue with that, that investment as we go through the year. But at this point, we don't know what the additional costs or lost revenue will be in this 4-week period. But as you know, we monitor all of these costs and report them to both council and committee, and then to the federal provincial governments for programs like Restart. So, it's, as I think as I mentioned, Dan Cheney will be sending out a memo with some of the closures and so on later today in the next hour, I believe. And we will, continue to count on that positive partnership we've had with our colleagues at the provincial legislature and here in Ottawa at the House of Commons. Thank you.
Thanks, Mayor. Follow up for Mr. DeMonte. Will enforcement activities be any different this time around, or is it pretty much going to be status quo compared to the last significant shutdown that we experienced?
Yeah, John, I think, and I've said this several times, and I repeat it, and Dr. Etches has been clear, and I completely concur with her. This belongs to each and every one of us to understand what we're facing collectively as a community and have the proper behaviors that we should have to fight this, all the public health measures that we should take. And bylaw will, like we did in the past, continue to enforce when we see egregious or situations where people aren't doing that, and for our collective good to intervene. So the team is currently working with, as I said, the ministry and others. It's all, the devil's always in the details for us. So until we see the regulations and the details to get a clear understanding. But yes, John, we'll be out there with our bylaw team enforcing the provincial regulations.
Thank you.
Thank you very much. Next, we have Pat Uguccione at Ottawa Community Voice. Pat, did you have questions?
Sorry, I was on mute. My question is for Dr. Etches. I wonder if you can look towards phase 2 of the vaccination rollout and help me understand one of the priority groups would be those with chronic conditions. Is there a definition for that, or is that something that would be done in consultation with a family physician? Yeah, could you explain how that will work?
Yes, thank you. Phase 2 of the vaccination program in Ontario includes working down through the age groups from 75, 70, 65, 60. And then it also includes reaching people with certain health conditions. These are defined in the provincial guidance document for phase 2. And we start with the people with the highest risk health conditions. It is a limited list in the highest risk populations. People who have transplants, people who have severe renal disease or cancer. So there is a list there. The way to reach this highest risk group is through, we believe, the specialty care clinics and hospitals that care for these patients. And so we have started conversations with our hospitals about how they would identify and reach these patients. When we go on further, then you get to another category of health conditions called high-risk health conditions. That's for people who have severe obesity or immunosuppression due to specific treatments like chemotherapy, people with intellectual or developmental disability. Again, we are going to work with our healthcare partners to ensure that people who fall into these categories are notified of their eligibility for the vaccine, and will most likely offer different channels, different options to people for how they can access vaccine. Of course, if they're above the age group being served at that time, they can go to the mass clinics. We're looking at other options with family doctors, with pop-up clinics, and so this will be further communicated to people. Beyond that, we start to get into a much longer list of health conditions that are more prevalent, like diabetes or pregnancy, actually. It's not quite that's a good condition usually for most people, but this again is going to require multiple channels. So there will be different ways that we will work to identify people, working with our health system partners. As vaccine becomes more available, we'll be able to get more out to primary care providers, or have primary care providers also serve their own patients in our mass immunization clinics. That is something that people have indicated they're ready to do.
And the announcement today that 11,000 doses of, I think, AstraZeneca will be available to primary care physicians. Is that by age, or how is that going to work?
We are just getting notice of this in terms of the vaccine that's going to be available for which sites. And my understanding is that we would use the same type of approach as for the pharmacies, where the AstraZeneca is available for people 55 plus, but I do need to confirm the details of this with the province and our team.
Thank you.
Thank you very much. We will now be going to Liz Payne at the Ottawa Sun.
Hi, thank you very much. It's a question for Dr. Etches. The lockdown announced to begin on Saturday essentially puts the entire province under restrictions that are exactly what Toronto and Peel have been under, with except no patios. And cases have continued to rise there. They continue to be the hotspots in the province. Does this lockdown go far enough in your view, especially given the variants right now?
I think that we will have to evaluate that. It has been the case that when people get the measures, communicated that this is a severe situation, everyone needs to do their part, that people in Ottawa have rallied. I think I really respect everyone continuing to underline that a lot of this is about our choice, what's in our control, as much as what the provincial restrictions are. And so I do want to encourage people to do their part. You want to reach people who are younger, in their 20s and 30s, who may feel that this is not going to cause them severe illness, to say that we're getting there, where we will see higher numbers and we'll find severe illness, and that it does affect other age groups. That there's this spillover effect when transmission increases, it increases across all age groups, and we have significant populations that are more vulnerable still for severe disease. So I think we're going to keep a close eye on seeing that curve turn, and we'll look to see again about how things need to be addressed if there are ongoing places of risk in our community.
Can you give an example of what you might be looking at and what your response could be if you're not seeing what you want to see?
Yeah, I think the risk is close contact with people outside of the household. So if there are still, soccer games or basketball games and courts full of people who are not masked in close contact, these are risks. So we'll need to see what the understanding is. And usually when people have the new framework and the rationale explained to them, they have been willing to do their part.
Okay, thank you.
Thank you very much. Nous allons maintenant passer à Antoine Trépanier de Radio-Canada.
Bonjour. Ma question est soit pour M. Desmonté ou Dr. Etches, ou les deux. le premier ministre Doug Ford a dit aujourd'hui que c'était une course contre un virus extrêmement robuste et rapide et que ça prenait des nouvelles voies pour réussir à le dépasser puis à prendre le dessus sur ce virus-là. Évidemment, ces voies-là, c'est par le vaccin. Je me demande, avec 145 000 doses administrées à ce jour, est-ce qu'on est loin derrière le virus ou est-ce qu'on est, we have a fighting chance here? Ça ressemble à quoi, selon vous?
Je m'excuse si je n'ai pas compris tout, mais je peux voir un avenir où la population est plus protégée par le vaccin et on n'a pas les mauvais résultats pour les hôpitaux et le système de la santé parce que les populations plus âgées est protégée. Alors, ça peut être un succès. Je pense que c'est possible d'arriver là, oui, pas trop loin d'ici, mais ce n'est pas notre réalité aujourd'hui.
Monsieur Dumonté, au niveau de la vaccination, est-ce qu'on...
Je réitérais un peu ce que la Dr. Etches a dit. Avec le vaccin limité qu'on a eu à date, on était en mesure d'identifier les populations les plus à risque et on est intervenu là. Donc, on a eu un impact très grand avec peu de vaccins, c'est-à-dire les personnes âgées, les personnes dans les centres de soins de longue durée, etc. Donc, je pense que c'est un succès et on voit les résultats dans cette population-là par rapport à la mortalité, la morbidité et les hôpitaux. Par contre, il est clair qu'on a encore beaucoup de travail à faire. La structure est en place. La science est en place et le leadership avec Dr. Etches et son équipe avec quelles sont les populations qu'on doit faire et l'équipe est prête. Donc, avec l'avenir de plus de vaccins et vous avez fait allusion un peu avec les différentes voies qu'on a maintenant. Fait qu'on va avoir du AstraZeneca pour les groupes de médecins qui vont voir leurs patients. On a aussi les pharmacies qui viennent en ligne. Nous, on a d'autres stratégies qu'on a fait allusion tantôt au niveau des gens à domicile, etc. Donc, je pense que la machine, si vous voulez, commence seulement son travail et dès qu'on voit de plus en plus de vaccins, je pense qu'on va voir les résultats assez rapidement.
Merci. Et ma dernière question, c'est pour le maire, M. Watson. On a vu beaucoup de confinement, déconfinement, confinement, déconfinement. Est-ce que vous croyez que cette fois-ci, c'est plus difficile de convaincre la population d'Ottawa que c'est une bonne idée finalement de se reconfiner et de suivre ces mesures-là parce qu'on a vu clairement un relâchement dans les dernières semaines? À quel point c'est plus compliqué de votre côté de convaincre vos concitoyens?
Bien, certainement. Avec les vaccins, ça c'est une chose très positive. Et pendant les prochaines quelques semaines, on voit une plus grande augmentation des vaccins ici à la ville d'Ottawa, dans les bureaux du docteur, les pharmacies et certainement dans les centres que la ville est responsable pour. Alors, tout le monde est fatigué, les employés, les infirmières, des paramédics, des personnes qui travaillent dans les centres de vaccination. Mais c'est vraiment important de continuer, de répéter l'avis de Dr. Etches et les autres médecins, parce que ça, c'est la seule solution pour gagner cette bataille. Maybe if I just offer one comment in English as well. Look at the city is exhausted. The nurses, the personal support workers, the paramedics, the caregivers, parents, we're all really exhausted. And, you can see that we have usually daily meetings with Vera and Tony and Keith and others. And, we're all tired and we want this to be over with. But we have to call on the best instincts of our fellow citizens to start and to continue following the advice of our medical professionals. There's not a plan B in terms of beating the coronavirus. It's pretty simple. It's washing your hands, it's physical distancing, it's staying within your own household, and it's wearing a mask. And then it's going and getting a vaccine. And if all of those things are followed, we will be out of this nightmare that we've been living through for 12 months quicker and get back to some sense of normalcy and enjoyment in our lives. So I just wanted to say thank you very much to all of those individuals, the thousands of people who are involved in this battle that we're facing with COVID, frontline workers, caregivers. It's been exhausting, and I just ask for people's patience. We will get through this. We're a strong, resilient, intelligent community, and we're a caring community. So I just want to thank the people that I've had the honor of working with. I see them on the screen here. We never see each other very much in person anymore, but certainly Dr. Etches and Tony DeMonte and Keith. And a thank you to the press too, because you have acted as a lifeline to get vital information out to members of the public when often, you've been inundated with pressures and financial challenges within your own news organizations, but you've provided a vital public service to get that message out about physical distancing and other things that people have to do. And as I said, we will get through this, but it's been tough. Thank you. Merci.
Thank you very much. Nous allons maintenant passer à Kenza Deladi à TVA Gatineau, Ottawa.
Est-ce que vous m'entendez?
Oui, on t'entend.
Parfait. Donc, ma question serait pour M. le maire. Je sais que la Dr. Vera-Etches s'est déjà prononcée là-dessus. Est-ce que vous pensez vraiment que cette fois-ci, ce confinement de 4 semaines, ce sera vraiment le dernier selon vous? Est-ce qu'on est... ou est-ce que vous l'espérez, là, j'imagine? Je voulais juste vous entendre vous prononcer là-dessus.
Bien, certainement. J'espère que ça, c'est... on va voir le succès avec les prochaines 4 semaines. Certainement, ça c'est le conseil, l'avis que Dr. Etches et Dr. Williams et les autres personnes qui travaillent dans ce milieu dit que c'est la meilleure chance pour nous autres de gagner cette bataille avec COVID-19. Mais il n'y a pas une personne qui est capable de donner une prédiction pour l'avenir. Alors, chaque semaine, Dr. Etches et son équipe et Dr. Williams à le niveau provincial vont étudier les résultats avec les autres médecins. Et si ça c'est nécessaire d'ajouter plus des restrictions, ça c'est la possibilité avec les lois de la province et les règlements municipaux de la ville d'Ottawa.
Merci. Ma deuxième question, c'est pour M. DeMonte. Je veux juste savoir, vous avez dit encore beaucoup de travail à faire au niveau des vaccins. Je veux juste savoir ce que ça représente pour Ottawa d'avoir des pharmacies là, qui pourront administrer justement ce vaccin AstraZeneca très bientôt. Là. Ce que ça représente pour la ville d'avoir ce surplus-là de services. Je peux dire ça comme ça.
Bien, je pense que c'est positif. Ça faisait partie de la planification depuis le début. Donc, on a d'autres options. Via les médecins, les propres médecins, via les pharmacies, nos stratégies de cliniques de masse vaccination. Et on a plusieurs autres stratégies, les stratégies ruraux qu'on a fait récemment. Et on a d'autres stratégies aussi pour des groupes spécifiques que la Dr. Etches a identifié, les personnes prises à la maison qui ne peuvent pas se déplacer. On a des stratégies qui se préparent pour ça dans les prochaines phases. Donc, je vous dirais simplement que l'ensemble de l'ajout de vaccins d'une part, mais de méthodologie d'aller pénétrer à l'intérieur de la population pour aller chercher des groupes cibles, c'est super positif. Et encore une fois, c'est plus de vaccins qu'on a, plus qu'on va être en mesure de vacciner ces groupes cibles-là le plus rapidement possible. Et on va venir à bout à se rendre à travers de cette crise-là qu'on a.
Merci beaucoup.
Merci beaucoup à tout le monde. This is all the time that we have. C'est tout le temps que nous disposons aujourd'hui. Hope everyone has a lovely weekend. Bon week-end à tous. Merci.
Merci. Au revoir. Bye.